My name is Maria Pajan, and I am the director for the Center for Innovation in Campus Mental Health. And I am very excited to be joined by both Alison Burnett from the University of Guelph, where she is Director of Student Wellness, as well as Leah State, who is the Director for Student Wellbeing at Humber. If you have not joined one of our webinars in the past, you will see that we have closed captioning for both English and French at the bottom of your screen. As well, just a kind reminder to use the Q&A function during the 15-minute question period at the end of the webinar. And again, this webinar will be recorded and available on our website in a couple of weeks' time. And if you have not checked out our previous webinars, please know that they are all archived and there for your viewing. Before we turn to our official start, I would like to take a moment and do a land acknowledgement. And acknowledge that we are all viewing this webinar on traditional territories of the Indigenous peoples of Turtle Island. I'd like to express my deep gratitude and appreciation for those whose land I reside on. And for me, land acknowledgements do not exist in the past tense or in a historical context. Rather, colonialism is an ongoing process, and I must continue to build my own mindfulness of my own participation. I often feel a little bit odd to finish a land acknowledgement and then go on to content as if though nothing has happened. And so I'd like to also finish this land acknowledgement with a call to action for us all to consider how we could make changes in our post-secondary institutions to further break down the colonial systems. If you have not looked at our findings from our Indigenous post-secondary needs assessment over the last couple of years, I encourage you to do so, and I encourage you to share with folks in your organization the fact that we are currently open for our third Indigenous post-secondary needs survey. With that, I'd like to move to our content and share with you that we are going to be talking about the post-secondary mental health standard. I was really lucky to be part of the technical committee that helped create and shape the standard. And I've also been really lucky that over the past couple of years, I've supported a number of schools as they have implemented the standard. And today, after 5 years of the standard being out, Alison, Leah, and I thought, okay, let's get together and maybe share with folks where we're at, how we're doing, how we're continuing to do the work, and perhaps share with you some of the lessons learned. We know the last 5 years have been incredibly tough, and that oftentimes it feels like the standard is just one more thing that folks have to worry about. But we really hope you have some good concrete takeaways today. So for those of you that might not know about the standard are a set of flexible guidelines that are meant to be adaptable in any post-secondary institution across the whole country. It is not a simple checklist where you're done, like check, 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 I put it away, I never think about it. At the same time, it's not meant to be a hardship, and it is completely voluntary. And it is a great way of beginning to look at services on campus and look at how we can continue to improve what we do and how we do it for students. So for those of you that might not be familiar, the center came up with a toolkit a couple of years ago based on the work that we did with 5 colleges in the Toronto area. And this toolkit is a great first stop shop for all of you who might be new and or already in process of implementing the toolkit. And we have sort of 4 big areas that we focus on in the toolkit. One is an environmental scan that really looks at what are some of the best and exemplary practices in Canadian post-secondary institutions and how they align with the strategic pillars of the standard. We also worked with our friends at SRDC to create a deep dive of a self-assessment to measure the degree to which schools might be working at. So it's not just, are you actually implementing? Are you actually doing the work? But to what degree are you doing them? How deep is your work? We're going to also share with you some information about the tracker and the new version of the tracker and the policy inventory as well. In terms of if folks ask me, where should I start? What's one exercise I can do with my team, with my students? What is one sort of area that we can sort of just begin to do this work and to think about where we might start? This is a quick and dirty exercise, part of our toolkit, whereby schools, and in this case, the 5 colleges that we were working with, began to start tracking what they were doing with regards to the pillars. So if you're going to start somewhere with the standard, you'll see that there are 6 pillars, including crisis management, including early intervention, accessibility. And what we had schools do is begin to think about what have they already done in these areas that would fall under these pillars. And as a result, it was a great way to sort of say, hey, I'm going to celebrate my achievements, and hey, maybe these are some areas like accessibility, or in other cases, it might have been literacy and education, where I might want to put my first and initial work and energy in. Another great place to start is the tracker. And the folks at SRDC have been working really hard to update the tracker. So if you've used the tracker in the past, know that in the last couple of months, a new tracker has come out. Here is the scan by which you can get to the tracker. And the tracker is a great collaborative tool to help all of you track and assess the implementation that you've done. So one of the pre-survey questions that we got for this webinar was, how do I track my successes? How do I get a sense of where I'm at? The tracker has laid it all out for you, and we encourage you to have a look and to use it. The other piece that we want to talk about, and that's a big part of the toolkit that we created, is this rubric. So a lot of schools were struggling with looking at the pillars, looking at what they were doing, and they were just checking things off, but they weren't really happy with how it was assessing how deep their work was, how much of the work that they were doing was actually hitting what it was supposed to. And so the rubric put together some great questions for folks to do some further self-reflection. So for example, when looking at some of the work that you might be accomplishing, when looking at some of the policies that you might be creating, to ask yourself questions such as, have students participated actively and co-created with us when it comes to these policies? Does this practice encourage accessibility? How is it being monitored and evaluated? So again, one thing is to say, yes, I've done it, or no, I've not done it. But this is really that sort of deep dive into how successful is it, the work that we're doing actually. The other piece that's part of our toolkit is really getting folks to think about mental health policies and to have some deep discussions on campus about mental health policies. And one of the things that, with Bill 166 coming out, I encourage you to look at these questions and to consider these questions, but also to think about mental health policy for us as a province, how we can work together so that folks aren't starting from scratch. So if Guelph has a really great policy when it comes to something, exam policy, for example, how do we share and scale and share the learnings of that mental health policy so that not only does Guelph benefit, but our whole system benefits as well. I also want to just put out a shout out for our I can't say that word on a Monday morning, evaluation toolkit. So we've got the toolkit that'll help you in the work of the standard, but again, are we actually questioning the work that we are doing and evaluating the work that we are doing when it comes to mental health services on campus? This toolkit lays everything out for you, and I encourage you to take a couple of minutes and to download it and to look at how it too can be a step-by-step free tool for you to use. Again, our mental health standards toolkit, encourage you to have a look. And it was interesting at a recent presentation that we did in Ireland on the work of the standard. BPNet did a great survey in looking at how and where we're at when it came to the standard. And one of the things we've realized is that our toolkit is the second most downloadable resource as folks are doing the work. With that, I'm going to actually turn it to the folks that are in the weeds doing the work, and turn it over to Leah to share how and what is happening at Humber. Over to you.
Thank you, Maria. Hi, folks. It's lovely to meet you all. My name is Leah State. My pronouns are she and her. I'm the Director of Student Wellbeing at Humber Polytechnic. In my portfolio, I have mental health services, clinical services, which is our health center, accessible learning services, and wellness education programs, which is health promotion. Very excited to be here today. My hope is between Maria, myself, and Alison, you're going to get some tips and tricks that you can bring back. I looked at who was here today, saw a small number of folks who are pretty new to the standard. So welcome. You're in the right place. You're all in the right place, actually. Spoiler alert. Folks who are sort of what I would call in the messy middle, so quite familiar with the standard, and then folks who are quite established in the standard. So my hope today is to either quell anxieties or worries if you're new and overwhelmed, inspire, energize folks who are sort of in that messy middle, and validate and create some opportunities for self-reflection for folks who are deep in the work. So you're all in the right place, and I'm very happy to be here. Let's see if I can control the slides. I can, magic. Okay, brilliant. So I don't know who's on this webinar exactly, but for sure, if you work in the sector and we're friends, I've probably sent you this GIF before. I felt I had to include it because one of the ways that we were promoting this is how do we do this standard work when it feels like the house is on fire? And I suspect that this picture or image feels familiar to folks. It's this dumpster fire. It's unclear what's happening. It's floating down the current. No one's coming to save it, interestingly. And it's kind of happy looking, like it's cute. It's got a smile. And I chose it because I think for folks who are doing this work, our day to day can feel like this. It feels like we're being pulled along by a current, or we're in a whirlwind. We're always putting out fires, and we're smiling because like this just feels like our normal day, right? Putting out fires is something we're often thanked for a lot. That feels good. We're well resourced for in terms of service delivery. So it's something we're used to. And what I'm hoping that the fact that you're here spending time with us today and that you can take with you is that you have to remember you've got to get out of the current or the whirlwind to do this work, right? If you don't start flexing that muscle of moving away from the fire and protecting and containering some of your time, you're just going to always go down the current. You're always going to be on fire, and you're not going to necessarily have the time or capacity to do that upstream work. And that upstream work can be tricky. It's a different muscle. It's more relational. It's more creative. It's a space, again, it can feel like a luxury, but I can assure you, if you can go to that grassy knoll, if you can get out of the current and go to the grassy knoll or the grassy bank, or just get out of that whirlwind, you're going to be able to do so much with the standard. So I just wanted to share that. For folks who are feeling, well, let's see if it works. There we are. For folks who are feeling they're new and they're not sure where to start, I saw a question for folks who have logged in. They said, I don't even know where to start. I feel so overwhelmed. I can't even look at the toolkit. Start at the beginning. right? Just start at the beginning. It is a very good place to start, just like the song says. And if you're in the messy middle and you're still overwhelmed, that is also normal. You don't have to do all the things. You just have to do the next right thing. So I want to assure you, if you are feeling overwhelmed, you don't have to boil the ocean. You just have to do the next one right thing. And we're going to give you lots of ideas here. All right. So I'll talk very briefly about this. This is a diagram from the Mental Health Commission of Canada toolkit. But again, I think it's a helpful reminder. Again, if you're feeling overwhelmed, what are you really doing? You're basically establishing your foundation. That can be something as simple as downloading the standard and reading it. Because if you're like me, you might have one of those amazing aspirational folders that says read me in your inbox, and you might be pushing a whole lot of things there. So if you just take some time, download the standard, download the toolkit from the center, download the MHCC toolkit, take some time, read it, assess your current situation using the tracker that Maria talked about. And then it's really just about addressing your opportunity, a reasonable amount of opportunities, evaluating and continuously improving. So what does that look like on the ground to establish your foundation? Again, because I know for folks it can feel really hard to start, or some of us have been deep in this work and then have paused because of any number of things. So if you are re-entering this work, it's getting familiar with the standard. So downloading it and reading it, looking at the toolkits, looking at the tracker, finding a champion. So for us, the standard is woven into our well-being strategy, right? It's not a separate piece of work. It's embedded in work we're already doing. And our champions are our VP of HR, because, or people and culture, as we call it here, because it's our well-being strategy is both for employees as well as for learners, and our vice president of equity, belonging, and student experience, right? So those are our champions. And I know sometimes people finding the champions piece hard. In my experience from a political lens, our VPs are very invested in this work because they know it's critical to both employee well-being and also learner well-being, and ultimately learner success, retention, and graduation. And so they're very happy to support this work. It doesn't mean that you're necessarily going to get a lot of financial resources, but you can get some political capital that you can leverage from them. And we've been very lucky to have that here at Humber. Appoint a dedicated leader. I think that's really critical. If you have somebody at your institution that leads your well-being strategy work, or if you have a standards strategist, that's excellent. I know that's probably not feasible for many of us in this time period, but that could be that you as a leader are doing some of this work. It could be that somebody on your team, a frontline worker, is doing some of this work. So all I would say is just make sure it goes back to protecting and carving out that time. We have to be really careful. I think too often we abandon time that's not in necessarily what I would call reactive service or direct service or putting out a fire. So if you are the person who's the dedicated leader in your role, or you're giving that responsibility to somebody on your frontline team, make sure that time is protected, make sure that there are clear goals and performance metrics aligned with those expectations around them leading the work, and then identify key stakeholders. I always say well-being is not just my job. It impacts every other person across the college, right? Faculty, facilities, residents, advising. And so we cannot do it all. I think if you expect to do it all, and if you put that weight on yourself, well, first of all, you'll be really stressed out, and that's not the point. And you'll burn out. And I don't actually think your work will be very sustainable, right? Because even as people come and go, you need other folks to hold some of these pieces where they have operational positional leadership or purview or power to make those things happen in spaces and places you may not. So those key stakeholders are mission critical to advancing the work. I wanted to share very briefly Humber's journey. So in spring 2021, as Maria said, we were part of that consortium of GTA colleges who collaborated to adopt the standard, it took us probably a solid year and a half of coming together, doing the self-assessment, lifting each other up, and kind of really digging into the tracker as it was then to get a sense of where we were. Um, we took that work here at Humber, and again, we wove it into our well-being strategy, which was launched in May 2023. And we continue to develop and reimagine mental health services and supports at Humber to address those gaps. But I think the important piece of this picture is that's 4 years, right? Spring, actually, it's like 4.5 years. It's been a long time. So this work might feel slow, but again, if you look at things over time, we've accomplished some big things, and it's really just about managing your expectations. If you put in the work, good things will come, but it doesn't come fast. So here I just wanted to assess again, this goes back to folks who are feeling, again, perhaps a bit overwhelmed with the standard. My recommendation, my hot tip here is just print out this diagram. This is a really helpful diagram. I have it up on my wall. So if I'm ever feeling lost or feeling like I'm having one of those days where I'm that dumpster fire and going, what is even happening? I can look back at this picture and I can be like, right, okay, we've got these pieces in place, or these are the pieces we're working on. So I know, again, the standard can feel really overwhelming for folks. It's a big document. It's a dense document. If you're feeling like you're like me and you need a Coles Notes, this is a really simple cheat sheet that I would highly recommend you put on your wall. So Humber has done a lot of great work around service delivery, particularly in mental health services and accessible learning services. And I'm very happy to chat about that at another time. I'm not going to chat about it today because I'm really mindful how in the weeds that can get, but please feel free to reach out. What I wanted to focus on today were some of those upstream pieces around policy, practices, student engagement, mental health literacy, and that's what I'm going to focus on. But there's been some cool stuff we've been doing with the social model of disability and accessibility with our clinical nurse specialists embedded in our well-being, in our mental health services team. So do reach out. So what I've tried to do is I've tried to share some of the work that we've been doing, and I've mapped it onto some of the standards principles. So anytime you see a 5.2.2, like you see here, that's mapped onto a piece in the standard. So you can see bookending this slide. We've got our well-being strategy that's helped us Humber. We do annual reporting. We've just put out our second annual, report. You're welcome to look at that. Of course, our food strategy came out of our well-being strategy because food insecurity is a huge driver of student well-being, or lack thereof. You know, if our learners are hungry and underhoused and in precarious financial situations, that can be really difficult in terms of their ability to be in class, stay focused in class, etc. So the food strategy has also been published and we meet regularly around that. Maria talked a little bit about the policy work that is in the toolkit. I think this is mission critical. I know Alison's doing some amazing work with University of Guelph's toolkit. We also created a decision support tool for reviewing policies and procedures from a mental health lens. So it's not about policies that are quote unquote mental health policies, but it's looking at a health in all policies approach using this decision-making tool. Again, this is all available. And I think what I want to underscore about everything I'm sharing and what Maria is sharing and what I know Alison's going to share is that I get that this is a time where we are all probably our registrars and admissions folks, we're all competing for learners, right? These are tough times. I would say particularly in the college sector. But what I feel firmly is that we cannot compete on well-being. We have a moral imperative to support each other. So if you have a tool, again, so for folks who are quite familiar with the standard, doing great work already, if you are doing something great, I want you to reach out to your networks, whether that's through OUCHA, whether that's amplifying it through the center's site, I want you to amplify the amazing work that you're doing so that other people can benefit from it. I always say, or as I said earlier, you got to start at the beginning if you haven't started somewhere, but you don't have to start from scratch, just like Maria said, right? There are all these amazing things that have been created that we welcome you to take and adapt for your institution. So do please do that. I wanted to share from a student engagement piece because student co-design is so important. We have a student advisory committee. This is under 5.2.5. They gave us great feedback on the strategy. We're going to be using them as we go into looking at more service design work. We're bringing them into the service design work. So they're mission critical, I'd say, for our frontline services, as well as for upstream work. We get them to look at the things that we're pushing out with their lens. I'm sure many of you have peer wellness educators of some way, shape, or form. We're also working with faculties. Many of you, I'm sure, are. So we have many health sciences programs that intersect with well-being, nutrition, health promotion. So we're working with those faculty members to create evaluations and assessments and projects within class so that it's those students, not just our wellness educators. So again, this goes back to releasing control to see how others can support this work, to do our student-led wellness challenges. We co-created a wellness resource around healthy relationships for 2S LGBTQIA plus folks. We did that with a grant from the Center for Innovation in Campus Mental Health. So I know if you're feeling, gosh, we have no resources, that was a grant with a partner resource. So do please take those opportunities. Sometimes it might not feel huge, and I'm going to talk a little bit about that later, but every one of these things adds up to your commitment around implementing the standard. I would say the thing that I don't want to say most proud of, I'm proud of everything. We've done quite a lot of work around our literacy education, stigma reduction, and early intervention, and an inclusive post-secondary environment. We've got some great resources around recognizing, responding, and supporting learners in distress, both facing our learners and for our faculty and staff. We offer those online. We're hoping to embed them into the onboarding process. We also offer them in person. Around accessibility, we have some modules around responding to and implementing academic accommodations. I don't know about other schools, but at Humber, our number one disability within the accessible learning department is mental health disabilities. And when our learners' accommodations aren't implemented appropriately or correctly or in a timely fashion, that can drive stress and distress. So these modules are really important. And we're just finalizing an open educational resource around well-being in the learning environment. So again, that will be available to everyone across the country. And we'll share more and work with the center to put that on their resources once it's ready to be delivered. So I just have two very small messages of hope, maybe, depending on how you're feeling. I remember seeing actually with Alison, all the peer health educators in the GTA across the several universities and some colleges used to get together, and we would train our peers collectively. And we had a speaker one year, Adam Kuhn, who I think still works at U of T, and his speech was about how 100 pennies makes a dollar. And I think that that's really important because sometimes it feels like, well, what does reading one article do, or having one meeting, or doing one consultation with a student group, what does it do? Does it really advance things? The answer is yes. It might feel like a penny in the minute, but those pennies add up to $1 and they compound and they expand. And so collect those pennies, don't throw them away. They add up, they're important, and the work that you're doing is important. I think it's also important. A lot of times we look outward to do this work. And I think many of us talk about feeling tired or burnt out, or we don't feel like we have the support that we need. And so that's where I would invite you to look inward and do some self-reflective practice, because I think that can be really energizing in this work. So whether if I think about question 4, who energizes me in this work and when did I last reach out to them? That could be on the same campus, that could be another campus, that could be another post-secondary entirely, it could be a group. If you're further along, right, we had about half the people here were deeply involved in the standard. So for those of you who are further along, what's one insight, lesson, or success you could share with others? And how do you plan to do that, right? Because that will both energize you because it's going to validate the work that you're doing and you're going to be sharing it, right? Which is sort of the point of all this today. So do you take these questions, reflect on them when you have time? Do you reach out? Do you look at our Healthy You website? We're kind of revamping it, so feel free to check out now, but hopefully in the new year, there'll be some updates. But very pleased to pass it over to Alison Burnett.
Great. Thank you, Leah and Maria. It's a hard act to follow both of you, but I am pleased to share with all of you today some of the work that we've been doing at the University of Guelph. As was mentioned, my name is Alison Burnett, and I am the Director of Student Wellness at the University of Guelph. That encompasses health services, accessibility services, counseling, wellness education and promotion, our student support network, our Health and Performance Center, which is our sports medicine clinic, and sexual and gender-based violence support and education also fall under that portfolio. So I'm fortunate to work with a very dynamic team who all participated in our work to date. But where I'd like to start is just to talk a little bit about what, and I see some, whoa, not entirely sure what happened there with my slides. But the work around student mental health at the University of Guelph had a fairly substantial history dating back to even prior to 2013, in which a mental health advisory committee was established, and that committee did various work on developing a framework that was aimed to guide practices and policies and procedures on campus. For me, coming into this, for working in amongst this work over the time since then, it was important to acknowledge the work that came before and how we utilize that in the work around the standard. It was important to articulate that we're not, and it actually helped me with the feelings of overwhelm, that we're not starting from scratch. You're not starting from a blank state. You likely have lots of historical knowledge within your own institutions that can help ground the work that you're doing, what came before, what you're doing now, and then what could come in the future. And I think it's important to highlight that. Again, I don't know why the slides are all a little bit wonky in terms of the timing, but as we were going through that, the first block was supposed to be 2016, 2017 in terms of the timeline. It was a very challenging time as we saw an increase in deaths from suicide on the University of Guelph campus, and it made a lot of news stories. And we received significant criticism and public awareness with regards to that. And so that also provided, it's sort of the next iteration and the next opportunity to help move ahead some of the mental health strategy that we had been working on. We went through a series in 2017 of town halls and renewed engagement. At that point, we adopted the Okanagan Charter, and there was an action plan and progress reports that were released. Then we kind of went into a maintenance phase. Well, not maintenance, there was lots of work going on. And one of the key messages that back in that time, we talked a lot about a whole of the university approach, that the wellness of students, staff, faculty is a community initiative, not and doesn't rest solely in the department of one area. And so there were lots of different initiatives that were going on campus between 2019 and 2022. The launch of the Indigenous Initiatives Strategy and Anti-Racism Action Plan, recommendations on pedagogical innovation. All of these help feed into a healthy campus approach and to student health and well-being. At that time too, now it's funny, I have the gap analysis that we did during that time. I can be honest with you, that whole time frame is a little fuzzy at the best of times. I have very little recollection of us doing that work, but I do have the final report, which was very helpful. And it was certainly a great place to start as we started digging into the standard in more of an earnest type of way. So coming out of the pandemic, we've been having ongoing conversations with now none of none of the slides. I don't know what happened here. Anyways, coming out of the pandemic, the timing was good. We'd had ongoing conversations with our senior leadership team around student mental health and sort of in the context of the pandemic. We had the information from our audit tool that helped inform those conversations. We had existing and emerging literature and the real-time effects of the pandemic presenting in real time, which was very helpful to the conversations. At that time, the institutional leadership did listen to all of that. And we were fortunate enough that our president at the time really saw that as an institutional priority. And you can see it reflected in our institutional strategic plan. At that time, Dr. Yates, who was the president, she initiated a task force on student mental health, again, to build on previous efforts, but to establish a renewed commitment towards it and to identify recommendations that would positively impact student health. So myself and a faculty member, Dr. Andrew Papadopoulos, who is in population medicine in the Masters of Public Health program, and who we've worked together on numerous initiatives over the years, were appointed as co-chairs to the task force. From January to October 2023, we undertook sort of the task force. We did not take sort of what was deemed the usual approach for U of G, which, the initiation of a task force, there would be a committee that would be brought together, and then you would go through a series of meetings and do all the things, and there would be a report at the end. Andy and I decided to take a bit of a more unconventional approach, I guess some might say, and focused really on engagement with the community. So we hired 2 graduate students who both at the PhD level, and we did multiple engagements in various ways. So there was a survey, there was focus groups, there was an open conference session that we did. We had tabling in different areas. And the key was engaging students and faculty and staff as well in designing what those recommendations would be in terms of for the task force. At the time, we did take in a fair amount of heat in terms of our process for that. But when the document was delivered, I know it says October 23, but we actually had a document at the beginning of August. So from January until that time, what then came through as feedback was the amount of work we were able to do in a short period of time in order to get those recommendations, that they were co-created with students, that they were engaged, and that it didn't take what often felt like long periods of time to get to that stage. The other piece that, while Andy and I were co-chairs for that, we had 2 graduate students but the resource intensity was not heavy, which was, I think, a benefit to our president in terms of financial impact. And I think the fact that we had done all this work prior to that time and the engagement with the community, mental health was not a new thing to them. Our campus community, by and large, are well bought into the idea that student mental health is important. There's been lots of opportunity for engagement over the years. And so we just kind of built upon that. What else can I say here? I think that's about it there. I'm aware of the time, so I'm trying to move a little bit quicker. Again, our guiding principles that went into the report, and I'll post a link to the website with the full report on it that you can take a look at. But the guiding principles around co-design and meaningful engagement, the whole of the university approach, the effective and ongoing communication, evaluation and continuous improvement, knowledge informed, and the sense of belonging and community were all guiding principles that came from, these were reoccurring themes that came out through the consultations and that seemed to resonate, and they resonate with the collective wisdom that was expressed at the University of Guelph. while leaning in on promising practices and acknowledging the important role innovation and Indigenous ways of knowing can contribute to student well-being. So this was all pieces of our report that helped fuel the recommendations. For us, for me in particular, I too felt overwhelmed by the standard. I'd read it numerous times. I re-engaged with the document and the work that we'd done in the gap analysis, so I understood that a little bit more. But for me, there was a series of frameworks and models that helped guide our work. It was the Keys dual continuum model of mental health, that you can have, it's not just the absence of mental illness. There's the Okanagan Charter that helped frame, to our leadership. It was the caucus systemic approach to campus mental health, which had been used in previous frameworks and was something that was well understood by our campus community. So continue to draw on that in order to move forward some of the standards was important. Rather than introducing another approach or another framework, there was lots of similarities that you could just build upon. As you know, the ecological model is a foundational document within the standard, and breaking that apart, again, people understood that already. And then defining mental health for people, well-being and wellness, the whole person approach to making sure that we were all sort of on the same playing field in terms of our understanding and definitions of what these things meant. As a result, we came up with 40 recommendations across 7 pillars, and you'll see those all there, and they map closely to the standard, although it's written in meaningful ways that it resonates with our community. So I can map it to those things, we can speak to those things, but the standard, it wasn't necessarily the primary focus in the work that we were doing. So some of the successes so far, we will be launching a health and wellbeing first-year course that will be open to all students come 2026, that will talk about not just well-being and access to resources, but also have skill-building components. And it's an existing course that's being redeveloped between 2 faculty members on our campus. As Leah mentioned, we are launching our Health and All Policies Toolkit, which is looking how, giving people a framework to review policies that are being developed with that mental health lens, and providing a statement about the impact of that mental health and how we're mitigating factors that might come as a result of the policy that's being developed. I'm happy to share it. It's just in the pilot stage still at this point in time, but I'd be happy to share that once we're in a good spot with it. Campus master planning has incorporated mental health in terms of, looking at spaces on campus and how they can better impact senses of community and belonging. We initiated a faculty ambassador, student wellness ambassador. So these are individual faculty members who we meet with on a regular basis and provide training to about student wellness, all of the various pieces, so that when they're in departmental meetings, they can speak to student wellness almost like one of us going to. And so then you've got that peer-to-peer, colleague-to-colleague type of interaction that helps educate and provide resources. We've done, and we have a strategic framework moving ahead around food security. We launched a trauma-informed care training and we've had over 500 people, staff and faculty trained in trauma-informed approaches. Our community collaborations, again, I can speak to these in more detail, but obviously since those recommendations, actually we had a board report last week, and we were able to comment that of the 40 recommendations, movement had been made in some degree across all 40 of those recommendations. And not all of those don't sit just in student wellness, they're across the university. When the recommendations were put out, people were kind of tasked as sort of leaders for those things. And then we have a project manager who meets with them and brings that information back. So it's the continual communication that is important. So where are we now? like I mentioned, we are in our ongoing implementation and progress tracking, having people responsible for various recommendations, how we bring that back, how we utilize that in terms of our reporting and communication. In the link that I'll send you, you'll see there's a tracking on the President's Task Force website on where we are around our recommendations. The fact that there's a new tracker that Maria mentioned earlier, I think will be important for us as we go into our next iteration and thinking about it, using that to map some of our gains, and our evaluation and reflection components. The evaluation piece, what impact are we having through these, is always the challenging question, and what people want to know, and so making sure that we're paying attention to those. And then, like I said, planning for the next iteration. It's 10 years before us, probably going to be well into the future that we're going to be talking about it. And so what do we want to do for the next iteration? How do we want to, move the standard just that much forward, right? You don't have to have the whole thing right from the get-go. It's small iterative steps that you keep moving and setting goals towards. And I think that's one of the biggest learnings that I've had over this process. I think I will leave it there with 10 minutes to spare for some questions. So I will turn it over back to Maria.
Thank you. That was fabulous. I feel like I personally have 1,000 questions to ask both of you. We do have one question in the Q&A, and I noticed already somebody had asked about the campus tracker and said that the QR code didn't work. I was hoping that our friends from SRDC who created the tracker alongside with support from the Mental Health Commission would be able to join, and I see they're not here. So I will let them know that QR code wasn't working, and I did put in the chat the direct link. But wondering, Leah and Alison, I'm not sure if you've downloaded the new tracker, but the question is, how do you download the tracker and upload information to it? But I see that that's really related to the new tracker. So have either of you done that for the new tracker, Leah?
I haven't. Oh, am I muted? I haven't done
No.
that yet. I know that it had just been released, so it's on my to-do list, because we're already working with information that we've gathered from the previous assessment and tracker.
Yeah. So what we'll do is for those of you, and I've noted who it is that's asked that question, we will circle back to SRDC and share with them QR code is not working. And I will send you a personalized message as to how to do that and how best to proceed. So apologies, they're not on the line to answer that question today. And then the next question is directed at Alison. And the question is, has there been any conversation around supporting students who identify as a caregiver on campus? I'd love to connect about how the Ontario Caregiver Organization could fit into the work of U of G to support student wellness and provide care. I guess that's a question for both of you if you have any work around specific to student caregivers.
So I know in the past we have done work around student caregivers. We had a student support network, or a student support circle. That's the right word. Specific for caregivers, with resources and things that were shared. We work with our student experience team or student life team, as some others may have, that might be what they're called in other campuses, around identifying those students who require some of that support. So certainly, Emily, happy to engage, or at least put you in contact with the people who are doing that work on our campus. Thanks for the question. Leah, do you want to add?
Well, I was going to add actually to the question above that asked about the tracker. There was sort of a part B to that question that I thought was really important. And I can answer, I can start, and I can flip it back to you, Alison, if you'd like. Appreciating that the tracker isn't one and done, and we all have limited resources, how should we think about indicating that one area has been sufficiently addressed? So that's a great question. And that's where you have to look at, first of all, your data, your gap analysis, but also, like, I'll give you an example. I remember when I first started, I used to work at a place before another school. I don't know. Can I name it? I don't know.
Why not?
Yeah, okay. I used to work at Sheridan. It's a great place. And I remember when I first started, we had all these students like being walked in from their faculty. They were crying, and then they'd come to counseling, and then they'd show up in the counseling office because I was overseeing counseling at the time. And sometimes they'd be like, I don't know why I'm here. My professor brought me down and I don't really want to be here, but I was sad. And so it was blocking counseling time, right? That other students wanted. So that for me immediately made me realize, okay, we need some mental health literacy around when somebody is in distress or visibly upset. Maybe counseling is a resource, but I always think of Mohsen Beg at the University of Windsor told me this story. The same thing happened, and a faculty member called and said, I don't know what to do. They're crying. And Mohsen was like, have you given them a tissue? Right? Have you said, do you know where to go? Right? Like, I think there was some capacity building work that was so clear that we needed to do. And I think what I would say is many of us are very well resourced around services, but it's that upstream work around mental health literacy and policies, right? We knew a lot of policies at other institutions I worked with, whether that was exam policies or like grade release, releasing grades the day before we go on break so that if people get a failing grade, what do they do? Because no one's answering their call before the break. Like there's things that you can do that I think will become very evident. So whether you're looking at your CCWS survey, because I know we're all doing that, if you haven't already done it, you're doing it this year because of the legislation, or whether you're just sort of seeing what is happening in your day-to-day practice, I would say this goes back to use the tracker, but also use your practice wisdom to sort of go, have we attended to this enough? Right? Because that might be where you are. You might not get all the things done, right? Great is the enemy of good. But if you have nothing, start somewhere. And then if you have felt that you have done something and it's attending to the need in the moment, then you can always move on to the next thing. So I hope that answers that part of the question, but I'm happy to pass it over to Alison or back to Maria.
And I'm going to pass it over to Allison in a second, but I think in terms of that second part of the question, that's where we also felt the rubric came in. And so looking at the questions that the rubric asks you to think about also gets to that scratching of beyond the surface, right? So I'm doing it, but am I doing it right? And am I doing it deeply? And am I doing it thoughtfully? So if you have a look at the questions in the rubric, that'll begin to sort of scratch at that as well. Allison?
Yeah, I don't have much more to add except to say that, the data will tell you in terms of whether or not you've done enough in that area, right? In terms of what's coming back to you and your collective, like your practice wisdom, as Leah so eloquently stated, are definitely two key things. The engagement piece that you have with folks on your campus will help you prioritize and identify where you should be focusing your limited resources, because you're right, you can't do it all. And so where's the laser focus on the things that you can have direct impact now and will be most meaningful.
Absolutely. I don't see any other questions come up, but one of the questions.
Oh, Mari, I think there is one in terms of including Indigenous students and
Oh,
perspective.
yes, sorry, thank you.
That's okay.
If you could speak to that.
Leah, did you want to go first or do you want me to go first? You're on mute.
I'm happy to go. Alison, you go, and then I'm happy to add in.
So at U of G, we work closely with our Indigenous community in terms of when we were putting the report together. We did some specific focus groups with that population as well as other individual groups on campus. We utilized some of the Indigenous initiative strategy work that had come before us to help inform some of our recommendations. Those were, and then the ongoing dialogue that we have various tables with our Indigenous leaders on campus as well. as well as our students. So making sure, like within student wellness services anyway, we have an Indigenous student who participates in our advisory committee. So we can try and make sure we elevate and lift the voices of various groups on campus to make sure that they are heard. I think those are just a couple of examples, but very important. And I thank you for the question.
Leah, anything to add?
I was going to say very similar things, and I think it goes back to a point that both you, Maria, and Alison have spoken about. It's how are we weaving this work into existing frameworks, right? So Humber also has a really robust Indigenous education strategy, and so it's not about something different. It's about the coming together and the braiding together of this work with campus partners, including our folks in IENE here at Humber, and amplifying those voices within this work.
Beautifully put. I want to thank both of you, Alison and Leah, for a great discussion. I've learned so much. I'm sort of thinking back at our standard toolkit and what we need to add and expand on. So massive thank you. And massive thank you to all of you who attended today. We hope that you'll take a moment and fill out our survey. That just helps us know that we are meeting the mark when it comes to our webinars. Also, a kind reminder, if you have not filled out our general needs assessment that's circulating right now, please do so. That's how we make sure that the work that we're doing is meeting your needs. And also a kind reminder, if you attend 4 or more of our webinars, you are eligible for a certificate. So let us know how we're doing and know that we are here for you. And thank you so much for attending today. And we look forward to continuing the conversations around the post-secondary national mental health standard. Thank you, everyone.
Thank you.